Hi, carbamazepine or Tegretol has been used for treatment of epilepsy and other conditions for more than half a century right now. Let's talk in details about carbamazepine and how it works and what condition it treats and how it is not for everyone with epilepsy and how it can even worsen some types of epilepsy and why Asians should be worried about this type of medication and what are the long-term effects that are silent but damaging because of carbamazepine. I'm your epilepsy specialist neurologist, Dr. Omar Danoun. I just want to remind you that this video is for information only and is not intended to replace medical judgment. First question, what types of epilepsy carbamazepine treats? Carbamazepine, it can treat focal and generalized seizures. It is intended to treat focal epilepsy type, and it can potentially worsen generalized epilepsy such as primary generalized epilepsy and juvenile myoclonic epilepsy. So it is very important to know the type of epilepsy to be treating it accordingly. It is used in adults and children 6 years and older, and it can be used for children younger than 6 years in some certain situations. What other conditions can be treated by carbamazepine? Carbamazepine, like many other anti-seizure medications and brain medications in general, can treat multiple conditions. It can treat bipolar disorder with mood swings, and it can treat trigeminal neuralgia and pain in the face. So yes, it can treat epilepsy, but it can treat many other conditions. And yes, you can take carbamazepine even without having epilepsy, and it will not cause epilepsy if you don't have it. How does carbamazepine work and what is the mechanism of action? Carbamazepine works primarily on the sodium channel, so it is considered a sodium channel blocker like many older anti-seizure medications. It also can affect the L-type calcium channels. Interestingly, carbamazepine can affect the turnover of noradrenaline and serotonin in the brain, which can explain the effect on the mood and being a mood stabilizer. It also can affect the antidiuretic hormone release, which can explain the low sodium side effect of this medication. How to dose carbamazepine? Carbamazepine comes in multiple forms. It comes in tablets, extended release, chewables, and suspension. There are some studies on IV forms of carbamazepine, however, it is not available in the United States. Before starting carbamazepine, we need to perform a few testing. We need to do a complete blood count, liver function test, kidney function test, and electrolytes and sodium. And in certain populations, such as Asians and hence Chinese and Vietnamese, we need to do a genetic study for HLA B1502 allele, which puts them at very high risk of skin reaction, allergic reaction if it was positive for them. In adult, we will start usually by giving 100 milligram twice a day for 1 week, and then we increase to 200 milligram twice a day for 1 week, and then increase to 300 milligram twice a day afterwards, and then reassess the response. And we can measure the blood levels as well to kind of see how the reaction was. And the maximum dose is 1600 milligrams total dose in a day. And yes, in clinical practice, we have gone faster titration, and sometimes we go to higher doses of 2000 to 3000, and this is in specific patient who can turn over the medications much faster, and their liver is processing medications faster due to a genetic variation. In children, all dosing of medication is weight dependent. We start by giving 10 to 20 milligram per kilogram per day in 2 or 3 divided doses. For example, if the child weighs 20 kilograms, then 20 times 10 is 200. So we give 100 milligram twice a day as startup dose, and then we can increase gradually every week. And the maximum dose is 35 milligram per kilogram per day. Because carbamazepine is an enzyme inducer, which means it will induce the liver enzyme, makes them active and process the medications faster. It can affect its own processing by the process called autoinduction, and this happens maximum between 3 and 5 weeks. So that's why it is advised to check the blood levels after that time so that we make sure it is appropriate in the blood. We measure the blood levels of carbamazepine to make sure it is being processed in the blood correctly and the liver is taking care of it appropriately. Normal levels usually range between 4 and 12 microgram per ml. The most important thing is slow titration of this medication. When you give the medicine slowly, you give the brain and the body a chance to adapt to it. That will decrease the side effects and give better chances for the patients tolerate the medicine and be on it for longer. I see some people will push the medicine too fast, and that will cause lots of side effects, and the patient will stop taking the medicine because of the side effects, not because the medicine is not working for them. What should I do if carbamazepine is not working for me? We know that anti-seizure medications might not work for multiple reasons. In the case of carbamazepine especially, we should make sure that we are treating the correct diagnosis and the correct epilepsy type. And we know that carbamazepine can worsen generalized epilepsy and primary generalized epilepsy like juvenile myoclonic epilepsy. So it is important to make that correct diagnosis before starting the treatment. The second thing is not giving enough time or enough high dose. So we, as a rule of thumb, we should give high dose and long enough time. High dose means to push it to 300 or 600 twice a day, and enough time means that we have to pass enough time for the medicine to work, about 3 to 6 months to judge it. A rule of thumb is we multiply the inter-seizure time, which means that how long it takes for seizures to come back. For example, if seizures are happening once a month times 3, so 3 times the inter-seizure period is the period of time that is successful treatment. If the patient misses 3 cycles, that means that the medicine is working. The third possibility is that you might be having what we call drug-resistant epilepsy, which is a special type of epilepsy when seizure medications will not control the seizures. If you fail 2 or more anti-seizure medications that are appropriate for the epilepsy syndrome, and we can investigate and possibly do some surgical treatment as we explained in the drug-resistant epilepsy video. What are the side effects of carbamazepine? The common side effects of carbamazepine are nausea, vomiting, dizziness, ataxia, imbalance, tinnitus and ear ringing, blurry vision, nystagmus, diarrhea, rash, itching, and fluid retention. Because it affects the antidiuretic hormone, it can cause drop in the blood sodium, and because it is a very slow process, usually you will not feel it unless we do a blood test to see the sodium, and it can drop even to very critical values. It normally between 135 to 145. It can drop to even 120 without the patient feeling it because it's very slow process, and it can drop even lower and be dangerous if it was even faster. If this happens, it is not scary. We can deal with it very easily by doing fluid restriction, means decrease the free water intake to less than 1 liter, and that usually fixes it very well. It can really affect the liver and do bone marrow suppression, which means that the bone marrow will not produce cells like white blood cells or red blood cells, which can cause pancytopenia or anemia. It can affect the kidneys, the pancreas. Also, it can affect the heart conduction and electricity of the heart and cause heart failure as well. There is a black box warning by the FDA for carbamazepine, mostly due to an allergic reaction such as Stevens-Johnson syndrome and toxic epidermal necrosis (TEN), especially in Asians and people who are positive for the HLA-B1502 allele. That's why we have to do slow titration to give the body a chance to adapt to this medications, and if anything can happen, we will pick it up very quickly. Carbamazepine can cause sexual dysfunction because it can increase the processing of the testosterone and affect the estrogen in the body, and can cause sexual dysfunction in males and even in some females as well. And luckily, this is rare to happen. Carbamazepine can induce the liver enzymes, as we said before, which makes the liver process medications much faster. So it does interact with many other medications that are processed in the liver, such as Coumadin and other medications, and it also can process the estrogen faster, which makes birth control pills, estrogen-containing birth control pills, not effective, and that will make failure of contraception more common. So usually we do not give oral contraceptive pills with carbamazepine due to higher chances of failure. And in the long term, carbamazepine might cause silent damage to the bones and cause osteoporosis, which can lead to fractures. So that's why it is very important to take calcium and vitamin D to prevent those bone loss on the long term, especially in women after menopause. How to monitor carbamazepine? The monitoring of carbamazepine is important. The first is in Asians, before starting the carbamazepine, we check for this allele, HLA-B1502, to prevent any allergic reactions. We monitor the blood levels of carbamazepine by checking the blood levels, especially at the beginning of the treatment. And one trick that I will tell you is that there is a metabolite called carbamazepine epoxide. And epoxide is that metabolite that causes all the side effects, and it is not detected in the normal carbamazepine levels, and the doctor has to order that if they are concerned about the levels are normal but the side effects are high. We check routine blood work every usually 6 months or 3 to 6 months depending on the case. We check the CBC, blood count, liver, kidney function, and electrolytes. And we always give vitamin D and calcium to prevent bone loss. And we check DEXA scan, which is bone density scan, to make sure we are not missing any osteoporosis that needs to be treated. Can I drive or drink alcohol with carbamazepine? The answer is we know that carbamazepine can cause initial dizziness and drowsiness and sleepiness, so you will not be as sharp as you are before with starting this medication. It is better to avoid driving until you are used to this medication. And if you take it for epilepsy, you already should not drive if you are having epilepsy and uncontrolled seizure. Alcohol also interacts with carbamazepine, and you should not drink alcohol while taking carbamazepine because both of them can affect the liver, so it is better not to drink alcohol, and also alcohol can trigger epilepsy and seizure. How to stop carbamazepine if it is not working for me? Stopping carbamazepine, like all the anti-seizure medications, has to be done very slowly over multiple weeks, about 8 to 12 weeks, so slow titration and slow weaning, so that no withdrawal seizures happen. And the only time we do it quickly if there is an allergic reaction. Is carbamazepine safe in pregnancy and breastfeeding? Carbamazepine does cross the placenta and goes to the baby during the pregnancy, and it can cause birth defect and called malformations of development. Those malformations can happen in carbamazepine. We think of carbamazepine as in between in terms of safety. So the safest medications for pregnancy and epilepsy is lamotrigine, lamictal, and levetiracetam and Keppra and oxcarbazepine. And the worst medications for safety are valproic acid or Depakote and topiramate. Those medications better avoided in epilepsy. And carbamazepine comes in between. The chances of birth defect or malformations in general populations between 1 and 3%. The chances of birth defect in carbamazepine ranges between 2.6 to 5.9% based on multiple different studies and registries for carbamazepine. And yes, if you get pregnant on carbamazepine, you can continue taking it during pregnancy and monitor the blood levels, and in the majority of cases nothing will happen and you have a normal pregnancy. It is recommended for all women of childbearing age when they're taking carbamazepine to take folic acid, and folic acid will prevent potential fetal malformations, and it is very important for any women to take folic acid to prevent those complications. I myself give my patients 1 milligram a day of the folic acid if they did not have any history of previous malformation. Carbamazepine is safe in breastfeeding, and it is recommended, and all the major societies of pediatrics and epilepsy and neurology will recommend breastfeeding in people who are taking carbamazepine and anti-seizure medications because the many improvements and many benefits of breastfeeding on the growing brain of the child. But of course, we need to monitor for sleepiness and tiredness in the baby by the pediatrician. Now, understanding all the properties of carbamazepine, what are the best cases for carbamazepine use? So carbamazepine is best used for people who have epilepsy and have other psychiatric conditions such as bipolar or for mood, so it helps both of them. It helps people who have pain conditions, neuropathy, or trigeminal neuralgia, which can help both of those conditions. It can help people with focal epilepsy and adult and children. It is important to avoid it in Asians who have the positive allele because of a high risk of allergic reaction and the skin reaction that can happen. Since the invention of carbamazepine, we have second generation of carbamazepine called oxcarbazepine, which has less side effects. It can be safer in pregnancy, and this is a good second generation. And there is a third generation called eslicarbazepine or Aptium, and this is given once a day. It has less potential for side effects, and this is the third generation of carbamazepine that I will talk about those medications in future videos. So make sure that you're subscribed so that you don't miss any of those future videos about this medication and other videos about epilepsy. And we have many anti-seizure medications now available for treatment of epilepsy. And to learn more about all the anti-seizure medications and how how they work and which is the best medication for your epilepsy, you can see this video about all the details about anti-seizure medications. And stay healthy and see you in the next one. Salam.